Hello, my name is Nell, and I have things to say about disability, chronic illness, and mental health. I live with all of these things, and I have done for a very long time, and I share these things in the hopes that my experience and wisdom will help somebody else out there. If that sounds like something that interests you, I would love it if you would subscribe to the channel. Come back every second Wednesday when I upload new videos. It used to be every Wednesday, but that got to be a little too much. So every second Wednesday. And let me know what you think of my videos in the comment section. And if you know of somebody else who would benefit from or enjoy one of my videos, please feel free to share it with them. Today I want to talk about fibromyalgia. What is it? Does it exist? Is it real? I have fibromyalgia, so I'm kind of biased in saying that yes, it is absolutely real. But a lot of people doubt the existence of this condition, and they doubt the people who say they suffer from it. I want to explore that today. I want to explain exactly what this condition is, and I want to explore some of the reasons why people have historically been so skeptical about it. I will also be working through a lot of information, so I do have a script that I'm working through, and so forgive me if I'm looking off the screen quite a bit because I can't remember all this information. I'm not that clever. Fibromyalgia is considered to be a syndrome rather than a disease. A syndrome is a group of related symptoms that don't have one single identifiable cause. The name comes from fibro, meaning fibrous tissues, that refers to the tendons and ligaments, meaning muscles, and algia, meaning pain. Fibromyalgia is predominantly a pain condition. The pain can be a burning or an aching pain. It can also have stiffness or spasms in the muscles and soft tissues. It also usually involves fatigue. It can feel like a never-ending flu, and it is also characterized by cognitive difficulties, which are lovingly referred to as fibrofog. The Mayo Clinic's page on fibromyalgia also says that fibromyalgia coexists with other conditions such as irritable bowel syndrome, chronic fatigue syndrome, migraine and other types of headaches, interstitial cystitis or painful bladder syndrome, temporomandibular joint disorders, anxiety, depression, and postural tachycardia syndrome. That means that the name and its reference to fibrous tissue and muscles can be misleading because it's not just about pain and it's not just about muscles. It affects every area and basically every system of the body. According to Fibromyalgia Australia, 3 to 5% of Australians, approximately 1 million Australians, suffer from fibromyalgia. The Fibromyalgia Care Society of America give the US numbers as 3 to 4% or 10 to 12 million Americans, and Fibromyalgia Action UK states that 2% of UK's population, that's approximately 2.5 million people, live with fibromyalgia. The majority of these sufferers are female. In fact, females are 3 times more likely to develop or at least be diagnosed with fibromyalgia than men, according to a 2018 paper written by E.J. Visser at the University of Notre Dame. According to that same paper, fibromyalgia can develop at any age, but it is more likely to develop between the ages of 30 and 60. The actual definitive cause of fibromyalgia is unknown. According to the Mayo Clinic, many researchers believe that repeated nerve stimulation causes the brain and spinal cord of people with fibromyalgia to change. This change involves an abnormal increase in levels of certain chemicals in the brain that signal pain. In addition, the brain's pain receptors seem to develop a sort of memory of the pain and become sensitized, meaning they can overreact to painful and non-painful signals. And according to Fibromyalgia Australia, abnormal pain processing has been demonstrated in brain scans of patients with fibromyalgia. Research is now being carried out in different areas to discover why and how these changes are taking place. They are looking at genetic components, brain inflammation, neurochemical imbalances, and stress hormones. What most of the research is pointing to is that the central nervous system, which is, it involves the brain and the spinal cord and carries messages and sensory information and motor commands throughout the body. The central nervous system of people with fibromyalgia essentially malfunctions. It sends the wrong messages. There can also be some abnormalities in the soft tissue and the nerves, with these things having a dysfunctional relationship and sending having dysfunctional interactions with each other, it leads to an amplification of the brain signals. So for people with fibromyalgia, their bodies are absolutely telling them that they are feeling extraordinary amounts of pain. There are quite a few factors that are believed to lead to these changes in the brain developing. One of them is genetics. It's been seen that fibromyalgia can run in families. So there is a belief that certain genetic mutations could make people more susceptible to these brain changes. Another is infections. Some illnesses have been seen to trigger or aggravate fibromyalgia. Things like the flu or glandular fever, hepatitis B and C, Ross River virus. Another factor is trauma. It could be physical trauma, things like accidents that could lead to broken bones, physical assault situations, or even psychological stresses, prolonged psychological trauma. It's sometimes been seen in people who experience post-traumatic stress disorder. Prolonged psychological stress, which can change the way that the central nervous system functions. It used to be that to be diagnosed with fibromyalgia, a rheumatologist or doctor would press on 18 specific sort of tender points or pressure points to see which one of those was painful. And you had to have a certain amount of those be painful to meet the criteria for fibromyalgia. This is no longer used by most doctors, and the updated diagnostic criteria is looking more at the holistic person and looking at other symptoms related to fibromyalgia. According to the Mayo Clinic, the requirements of meeting the criteria of widespread pain are to have pain in at least 4 of the 5 following areas: left upper region, including shoulder, arm, or jaw; right upper region, including shoulder, arm, or jaw; left lower region, including hip, buttock, or leg; right lower region, including hip, buttock, or leg; and axial region, which includes neck, back, chest, and abdomen. This is used by the American College of Rheumatology, and they also have designed a preliminary diagnostic tool that looks at these pain regions as well as pain severity and other symptoms. Some clinicians might use a fibromyalgia questionnaire designed by Dr. Winfried Hauser and a Canadian fibromyalgia consensus document, which looks at neurological symptoms, fatigue, sleep disturbance, stiffness in muscles, and other symptoms. Diagnosis also usually involves ruling out other conditions. There is no cure for fibromyalgia. That's what happens when you don't know what causes a disorder or a syndrome, especially when there's evidence that it's a disorder of the central nervous system. However, many of the symptoms can be managed or at least minimized. No single treatment works for all symptoms, and no single treatment will work for all patients or sufferers. Many patients will have to try different treatment options and maybe even try combinations of different treatments. One treatment option is medication, and one of those is pain relief. Usually people will go for over-the-counter pain relief. Things like acetaminophen, which is Panadol here in Australia, Tylenol in the US, ibuprofen, which is Nurofen here, and Advil elsewhere, naproxen sodium, which is Aleve. Opioid medications are usually avoided because fibromyalgia is a long-term illness, and opioid medication can cause dependency, can cause severe side effects, and in the long run can worsen pain. Antidepressants are also often used to treat fibromyalgia, partly because antidepressants can help with pain and fatigue, but also with the mental health aspects that often come with fibromyalgia. Common antidepressants that have this dual purpose are duloxetine, which is known as Cymbalta, milnacipran, which is known as Jonica or Savella, and amitriptyline, which is known as Endep or Elavil. Some doctors might also prescribe seizure medication, things that were designed to treat epilepsy, but have now been discovered as being useful to treat fibromyalgia, because these disorders have been found to operate in the same way. Some of these medications are gabapentin, which is often sold under the name Neurontin, and pregabalin, which is known as Lyrica. Another option is therapy, physical therapy can help, particularly with an exercise physiologist who is experienced in dealing with long-term chronic conditions. Physical therapy can help you improve strength, flexibility, and stamina. A lot of people with fibromyalgia find that water-based exercises put less pressure on their muscles. Occupational therapy can also be really helpful. It can help you find new ways of adjusting things in your lifestyle, at home, at work, finding new ways of cooking, of moving, of dressing, of working, of doing your hobbies. It can even help you find assistive technology to, set up around your home to make things easier. And another type of therapy is counselling. Fibromyalgia brings with it a whole lot of mental health issues, and so counselling is incredibly helpful to learn coping strategies with managing the pain, with managing the limitations that it brings into life. So that's fibromyalgia. It's real. It exists. If you had never heard of it before, and you had just heard me spend, the past 10 minutes detailing this central nervous system syndrome that has distinct diagnostic criteria and is treated with recognized medications, you might be wondering why I would bother asking the question, is it real? Because why doubt it? I'm asking the question and answering that question because over the years there has been doubt. There has been doubt in the medical community about whether this is a real condition. There has been doubt about whether its sufferers are really suffering as much as they claim to be. There's been doubt in popular culture with people mocking people, those who have the condition, or making fun of it as something that's pretend or blown out of proportion. Even recently, there's been controversy about a particular YouTuber known as Colleen Ballinger, who had a character in a Netflix series of hers who claimed to have fibromyalgia, but it was always the butt of a joke. She would just use her fibromyalgia to get out of doing things. It was the butt of the joke that fibromyalgia was this fake disease that didn't actually affect anyone. It was just this throwaway thing that somebody would claim to have if they wanted to get out of doing things. This illness is horrible. It's real. It's hard to get a diagnosis. You have to jump through a lot of hoops. And so to see it being dismissed, especially in popular media, is frustrating. But I also want to talk about why historically there is so much skepticism. There are a lot of reasons. There is no definitive blood test. The cause of the pain is invisible. The symptoms can be vague. The experience can be different for each individual, and treatment can be hit and miss. Fibromyalgia has at times been a bit of a punchline. A diagnosis people claim when they can't get diagnosed with anything real. Even many doctors have doubted its existence, partly because it's so ephemeral and hard to treat. Doctors can even get frustrated with their patients because of the difficulty of treating and diagnosing this disorder. In an article on health.com, Dr. Todd Seitzman said some primary care doctors get frustrated by fibromyalgia and don't like treating patients with this condition chronically year after year, possibly because there is no cure. In this same article, fibromyalgia expert Dr. Daniel Clow says, sometimes doctors take out their frustration on the patients and blame the patients for their illnesses. Simply put, we annoy our doctors because they can't help us, and that makes them feel helpless. It used to be primarily handled by rheumatologists because people with fibromyalgia experienced musculoskeletal pain, which looked a lot like rheumatoid diseases. But research and testing was showing that people with fibromyalgia didn't have anything wrong with their musculoskeletal systems, which led to some doubt about whether people were actually experiencing the pain they claimed to experience. But as research moved forward, it was showing that the pain and the problem was in the central nervous system pathways. The experience of pain is there. It was always there. It just wasn't where people were looking before. Some of the skepticism was because of the lack and poor quality of research into fibromyalgia. In a 2009 article on brainandlife.org, Dr. John Kissel acknowledges that the majority of research in fibromyalgia was not adequate. Studies would pick some parameter and look at it only in patients with fibromyalgia and sometimes in normal controls without comparing them to people with other chronic pain conditions, people with depression, or to people with other muscle diseases. He also explains that the diagnosis of fibromyalgia used to be misused, thrown onto patients simply because doctors needed to give them an answer. In the same article, he says, patients would come in and say, I have muscle pain. The doctor would do all kinds of tests, electromyography, blood work, muscle biopsies, imaging, and if all that was negative, then voila, it was fibromyalgia. But that's not the way you diagnose. Because of the difficulty of getting a diagnosis of fibromyalgia, some people have had to live with approximate diagnosis, suspected diagnoses, or self-diagnoses. This throws up even more skepticism because these aren't seen as real or valid, even though the person's experiences are absolutely real and valid. This makes it even more difficult when a person's experience and symptoms might fluctuate. So people looking in from the outside might see them coping one day and struggling the next. They might interpret this as the person being selectively sick, only being sick when it suits them. This is despite the fact that for most of us with fibromyalgia, this disorder is robbing us of so much every single day. We wouldn't wish it on anybody. We're not doing it for attention. We're not making the most of it. We're not using it for convenience. We are doing our very best to survive with a brutal and unforgiving syndrome that has unreliable treatments and no cure. I do believe that we're moving forward. The medical community is moving forward. More research is being done, particularly by neurologists now, not just rheumatologists. And the use of functional MRIs showing the brain's response to the stimuli of pressure, pain, and heat are displaying the differences in the way people with fibromyalgia process the stimuli. In the article on brainandlife.org, pain specialist Dr. Miroslav Bakonja compares the malfunctioning of the central nervous system of people with fibromyalgia to those with epilepsy. He says, there's hyperexcitability in the nervous system on one hand and failure of inhibition on the other, which helps explain why pregabalin, a medication that is used to control epilepsy, can also be used to relieve fibromyalgia pain. This is a real disorder. It's a serious disorder. It deserves to be validated and respected, as do the people who suffer from it. Living with chronic illness is hard enough without feeling like you need to jump through hoops to prove that what you're living with is actually real. And the progression in research of fibromyalgia shows that over time, evidence can be found of these invisible illnesses. It shows that if people claim there's no evidence of an illness or disorder, it could just be that they're looking in the wrong place. Thank you for watching this and for learning with me. I have resources and my sources in the description box, as well as other articles that you might find helpful if you are looking through this. If you are somebody who lives with fibromyalgia and you do have people in your life who are questioning the validity of your diagnosis or your experience, please feel free to share this with them, because I'm personally sick of people downplaying it or seeing it as something that is, not entirely true or not entirely valid. The medical community is catching up, and it is time for the general population to catch up as well. We need to start dispelling some of these assumptions and skepticisms. So thank you so much for watching. Bless.